Welcome to the ABBRUPT Targeted GCP Training. The following presentation provides a brief overview of good clinical practice and is not intended to replace formal good clinical practice training. This presentation should only be used under certain conditions as agreed by the ABBRUPT Trial Office. So what is good clinical practice? Good clinical practice is an international, ethical and scientific quality standard for designing, recording and reporting trials that involve the participation of human subjects. Compliance with this standard provides public assurance that the rights, safety and well-being of trial subjects are protected and that clinical trial data are credible. GCP applies to all aspects of research. A clinical trial of an investigational medicinal product, a CTIMP, looks at the safety or efficacy of a medicine, foodstuff, placebo in humans as defined by the Medicines for Human Use Clinical Trials Regulations 2004. ABBRUPT is classed as a CTIMP because it is comparing amiodarone to beta blockade. There are 13 principles of GCP. Clinical trials should be conducted in accordance with the ethical principles that have their origin in the Declaration of Helsinki and that are consistent with good clinical practice and the applicable regulatory requirements. Clinical trials should be designed and conducted in ways that ensure the right, safety and well-being of participants. Informed consent is an integral feature of the ethical conduct of a trial. Clinical trial participation should be voluntary and based on a consent process that ensures participants are well informed. Clinical trials should be subject to objective review by an institutional review board. Clinical trials should be scientifically sound for their intended purpose and based on robust and current scientific knowledge and approaches. Clinical trials should be designed and conducted by qualified individuals. Quality should be built into the scientific and operational design and conduct of clinical trials. Clinical trial processes, measures and approaches should be proportionate to the risk to participants and to the reliability of trial results. Clinical trials should be described in a clear, concise and operationally feasible protocol. Clinical trials should generate reliable results. Roles, tasks and responsibilities in clinical trials should be clear and documented appropriately. Investigational products used in a clinical trial should be manufactured in accordance with the applicable good manufacturing practice standards and be stored, shipped and handled in accordance with the product specifications and the trial protocol. Systems with procedures that assure the quality of every aspect of the trial should be implemented.